Lovely. We are moving on to our final talk of this session, and just to note that the topic does contain information about baby loss and infertility. So, we will be welcoming Dr. Zoe Belshaw, who is a newly minted fellow, to present this session. The title of this is For 3 of My 4 Miscarriages, I Was at Work. Workplace Management of UK Veterinary Professionals' Miscarriage, Infertility and Assisted Fertility. Zoe is a veterinary surgeon with a clinical specialism in small animal internal medicine. She received a PhD from the University of Nottingham in 2017 for investigating welfare assessment in canine osteoarthritis and was awarded the BSAVA Pet Savers Award in 2020. She has worked in general practice, referral clinics and university teaching hospitals, and she is currently combining looking after a young child with her collaborative research on how veterinary professionals and owners make decisions about pets, particularly those with chronic illness, characterising the pandemic puppy phenomenon, and understanding veterinary professionals' experiences of infertility and pregnancy loss. We welcome you, Zoe.
Thank you. If anybody can't hear me at any point, wave at me and I'll try and move my microphone. Great. So as we've heard, this is going to be a talk about baby loss and infertility, and I appreciate that some people in the audience almost certainly will have been affected, such as the prevalence of this. I'll signpost some resources at the end for anybody that would like to see them. So first of all, to introduce my epic research team of Nat Scroggy, Abby Collinson and Jenny Stavisky. We came together having all experienced either baby loss or infertility whilst working in a veterinary workplace. We had hugely variable experiences personally of how that was managed. Nat's experience led her to setting up the Vet Minds space on Facebook, which is a Facebook supportive group for any veterinary professional who's experienced any form of baby loss or infertility. We were really interested in further exploring this, so came together as the Vet Minds research team to see what else other people's experiences were. So in terms of background, healthcare professionals might be at increased risk of miscarriage and infertility compared to the rest of the population. We don't have great evidence on this from the UK, but there are some suggestions that things like, for example, delayed age of having children, workplace stresses, and potentially workplace hazards may be contributors to this. What we do know for sure is that baby loss and infertility can lead to profound negative mental health consequences for those affected, and that how workplaces manage individuals with these experiences matter, and that's across the sector of any different type of job role. But there's very limited evidence about how UK-based vets and vet nurses experience this. So our study aims are really just to get some information on this, really, to investigate how work environments, managers and colleagues impacted veterinary professionals' experiences of what I'm going to truncate to MIAF. So that's miscarriage, infertility and assisted fertility, just to save myself time. And to collate recommendations from affected individuals so they could be available for educators and policymakers. So in terms of methods, we used an online questionnaire, which we developed for UK-based vets and vet nurses who'd experienced miscarriage, infertility or assisted fertility. We specifically sought to include non-pregnant veterinary partners, so either females or men, and collected multiple choice and free text data. We had ethical approval from the RCVS to do this, and despite applying for funding, we did the research unfunded because we felt that it was so important. We advertised the survey in the veterinary press, on social media and via employers, and we had the survey open from April to June last year, so this is relatively new data. In terms of what we collected people's demographics, their workplace type. We asked them to self-define what experiences they'd like to talk to us about. So some people collated all of their miscarriages, infertility, and assisted fertility experience into just one overview and told us about that. Others split out their experiences in up to 5 effectively repeats of the survey, and some people did explain 5 different episodes to us. We asked them roughly how long ago these things happened, and then when they're in the workplace, was there a policy that they were aware of that applied to them, whether that was for miscarriage, infertility or assisted fertility, what support they did or didn't get from colleagues, what helped, what didn't, and what they thought might improve. And for the numerical data, we did statistical analysis, and then we performed reflexive thematic analysis on the qualitative data. The picture on the right there is just an example of the advert that we used. So as a research team, we were very happy to be open about our lived experience in this field. And so we advertised it saying, we've experienced this, have you? We'd really like to know more. And brilliantly, 545 people did share their experiences with us. And between them, they described 671 different experiences. And as I've said, that these are self-described. So that's probably an underestimate because some people did appear to roll quite a lot of experiences into one. 96% of our respondents were female, with only 20 men, and they split approximately 2/3 vets and 1/3 nurses, which reflects the other talks we've seen this morning, I think. Approximately 55% experiences were in the past 3 years, some were more than 20 years ago, and I think that really shows how little research has been done in this space before and how impactful these experiences can be on people, that those individuals are motivated to still take part. Also to say, we did have 2 students who took part in this, so this is very much not something that's just about vets and vet nurses. This is happening to students as well when they're going through vet schools and veterinary nursing training. In terms of the experiences were described, predominantly miscarriage, smaller numbers of infertility, assisted fertility. TFMR is termination for medical reasons, and those were subsumed into miscarriage for the purposes of analysis. And again, similar to what we've already seen, demographics broadly reflecting what we've seen in sort of the profession as a whole. The majority of people in small animal clinical practice with smaller numbers in the other sectors, but still representative of all those other sectors. So we asked people, when you had a MIAF experience, who did you tell? And you can see the majority of people told somebody, direct managers, colleagues, overall management. But 13% of people said they told nobody. We didn't ask in this specific question why that was, but looking at the free text in response to other questions, it appeared to be a combination of people wanting to maintain their privacy, but unfortunately other people feeling that they were at risk of workplace discrimination, or because they'd had such a bad experience of disclosure previously, of a previous MIAF experience, that they just didn't want to go there again. In terms of what workplace support was available for people, when we were doing this question, we made the assumption that people would be able to access statutory sick pay. I think probably on hindsight that was an incorrect assumption, that some people maybe didn't even get statutory leave. But the headline, I guess, of this is that 1/3 of people told us that they didn't get any additional workplace support when they'd had potentially a miscarriage or assisted fertility or infertility experiences. Now, that 36% does include those 13% of people who didn't tell anybody. That was our error in our sort of survey design, but that's still 1 in 4 people who are saying that they didn't access any of paid time off appointments, adjustment to work duties, unpaid time off for appointments, changes in work pattern, unpaid compassionate leave, or access to counselling. And some of these other things there were tiny little things, like supportive comments from colleagues, being sent flowers, or phased return to work, which we'll go on to later. So we were interested to interrogate these data further. Did employees' responses affect individuals' likelihood of them remaining in their job? So we asked them. And yes, there was some evidence of impact on job retention. So how these things were handled made no direct impact on whether people stayed in that job for 66% of people. 13% of people said my experience was so good it bonded me even more tightly to my team. But really sadly, 22% of people said that they either considered leaving their job or actually did leave their job, and that split approximately 50-50. So 10% of people approximately who'd had a MIAF experience was handled so badly at work that they left their job. Some of them even left the profession as a result of that or moved to non-clinical roles because they felt that they just weren't being adequately supported. So this really does matter, and we performed multi-level modelling to try to look at predictors of what made people leave and stay. Respondents were more likely to leave or consider leaving their job if they'd undergone assisted fertility as compared to having miscarriage or infertility. And shockingly, if they told their overall direct management, they were twice as likely to leave than if they hadn't told them at all. Respondents were more likely to stay if they'd received any form of workplace support, 5 times more likely to stay, so it's really impactful, or if they'd experienced MIAF under 3 years ago, which maybe suggests that some of the newer workplace policies, for example, having time off for assisted fertility, does make a difference. So in terms of what was going wrong, here is just some of the overview of the responses from the qualitative data. So people told us it was hard to take leave for appointments during or after a loss. So this is both for IVF, but also tragically, people were telling us that even when they were having a miscarriage at work, they either didn't feel that they could ask to leave because they felt that they were worried about their jobs, or that they'd be letting down their patients, or that they'd been denied the ability to leave because there wasn't clinical cover and they were told they needed to wait until somebody was able to come and take over from them. And that was not an isolated experience, unfortunately. They told us that leave was typically unpaid, or often it was too short, whether that was either for the IVF investigations and the treatment, or whether that was after a loss. They were rushed back to work. Typically, policy was either absent or it's contested. So, for example, it might be there at HR level, but they were being told by their managers, I'm really sorry, but you can't have the time off because your boss is away with the kids and we can't call him back. There was a much too greater expectation of full return to clinical duties. Some of that was individuals feeling themselves that they needed to rush back to work because they didn't want to let down the team, but other times people were being phoned while still in hospital saying, I'm really sorry, but are you going to be able to come back to work tomorrow? We really need to be able to plan the day. Risk assessments weren't always conducted. Having a risk assessment when you're pregnant is a legal requirement. Unfortunately, we found multiple instances of people not having risk assessments or feeling that they just couldn't enforce those risk assessments themselves. If they were lone working, if they were working in large animal practice, it could be very, very difficult to avoid doing procedures which a risk assessment had told them that they shouldn't be doing. We recorded many, many instances of what people perceived to be hurtful comments, miscommunication, or no acknowledgement of their loss. And many of these hurtful comments were probably people trying to be helpful. So saying, well, at least you know you can get pregnant, or it was only under 12 weeks, don't worry, you're young enough to try again. And many people felt that those comments really minimised their loss and really spoke to a lack of education in this field of what people's experiences were. And people really identified specific cases, scenarios, and work types that they hadn't anticipated being challenging, whether that was fertility work, having to go back and do pregnant spays, having to go back to work and work alongside pregnant colleagues, for example, were all things that people found very, very difficult and maybe hadn't anticipated that. So here's just a few quotes. I think this is a brilliant one that really sums up a lot of the problem here. I think pregnancy in general is still an inconvenience in the veterinary workplace because it does affect what we can and cannot do in such a big way. I felt like I had to do too much and not be fussy about the risks in order not to be the weak link in the team. And the same after miscarriage. I felt pressure to get over it and resume being a team player. And this team player identity is something that we saw in quite a lot of respondents. Here's one about risk assessment. In 4 pregnancies, not one risk assessment was done, despite repeatedly asking. I was told I didn't need them because I knew what to avoid. And finally, here's one that we may not have thought about. As a vet, I found infertility very hard to deal with. Infertile cows are sent to kill. So people are being impacted across multiple different ways in this sphere. So on the flip side, we remember those 13% of people who said that they had a good experience. What did those practices do well? Well, those people told us that they had a workplace culture of friendship and empathy. They weren't worried that they were going to lose their job. They weren't worried that they were going to have some of these sort of hurtful things said to them, that they felt that they would be accepted and people would be sympathetic and supportive. They were able to attend appointments, even at short notice. People said, no problem, if you need to go in 48 hours, then that's absolutely fine, we'll work around you. You're more important than your job. Things were individualised, so managers were having chats with people saying, how can we help you? Do you want to come back to work for fewer hours? Do you want to avoid specific procedures? Where we can accommodate that, we will. People were giving permission to take as much time off as they needed without guilt. And this without guilt thing is really important. Many people said they felt really guilty taking time away from work. That was a really, really big thing. There was clear communication around payment. So unfortunately, we had multiple instances of the bad side of things where people's pay was being docked unbeknownst to them for attending fertility appointments. One person, when they were in hospital after a miscarriage, that was counted as a day off, so she then had to work an extra day the following week, for example, which you kind of almost couldn't believe is true, but is what we were told by some of these participants. So a good example is there was really clear policy, there was clear communication. And there was an option for a phased return to work after loss. You weren't coming back sort of straight into the thick of clinical practice. People were being allowed to phase themselves back in. So here's some more positive quotes. Only my boss, vet female, was originally aware of my fertility issues. I honestly couldn't ask her to be more supportive. She's always there to talk to if I need to and has completely respected my confidence that I don't want anybody else to know about this. And this was a real thing throughout the data. People had very different perceptions of what the workplace was for, whether there should be any workplace support at all or not. Some people really felt that this is something workplaces should be leaning into. Other people told us, actually, this is literally nothing to do with my workplace. I almost don't know why you're running this survey. This is completely separate. Work's for work, home's for home. Just split the two apart. And just to show the impact of what we can do so easily, some colleagues asked how I was doing on my return to work. Being able to talk to these people, even just for a few minutes, helped me to deal with what had happened. So it really shows the impact of our own tiny little behaviours on how much we can support colleagues experiencing this. So in terms of recommendations, what did people say? Well, people requested flexible MIAF policies that included non-pregnant partners. Unfortunately, some of our male respondents told us that they'd been told by their bosses that they couldn't go to be in hospital with their partners while they were miscarrying because it wasn't their body, it wasn't their practice, and it wasn't their experience. And some men equally felt that they couldn't ask to take time off to be with partners who'd had a baby loss because for that same reason, it wasn't their body. People wanted it to be easier to take time off at short notice for medical reasons and not necessarily to have to go into a ton of detail with a HR person they didn't know about what the reason for that time off needed to be, which some people felt was very challenging. They wanted longer, paid, guilt-free leave for both fertility treatment and after losses. There was a general consensus that the 3 days that corporates are currently typically offering is absolutely nowhere near enough because you just can't fit fertility treatment into 3 days, and it risks effectively being looked at as tokenism. But some practices don't offer anything at all, as we've seen. So they wanted longer off. They wanted options of a phased return to work where somebody had a chat with them, said, what do you think is going to be okay for you to do, and trying to fit that around what other people were able to cover. They wanted risk assessments, importantly for those trying to conceive, which we didn't specifically seek to include here, but obviously many people are trying to conceive, and in this data set, that was a really big thing, that people felt that they were being penalised almost or put at increased risk because there were many pregnant colleagues, and because they weren't pregnant themselves, they were having to cover extra duties. They were doing more heavy lifting, they were doing more chemo work, they were being exposed to more radiation, they were potentially gassing down more exotic pets because they weren't yet pregnant, even though they were trying to conceive, because that legal right to a risk assessment doesn't yet apply to them. And that was a really strongly held thing, that this is important. And that risk assessment should also include the risk of stress. Workplace stress was identified as several people as really what they felt as being instrumental to their infertility, and that they'd left clinical jobs and subsequently become pregnant, and they very much found that that was because of this workplace stress. And finally, there was a really strong call, and I think these data demonstrate it, for better education, awareness and compassion across teams. I think that really needs to start at the vet school level. Everybody's going to work with people who have the capacity to get pregnant. They may well want to get pregnant themselves, either as a male or female partner. And there are vet students who are experiencing miscarriage, baby loss, who are not, let's say, having the best experience in the vet schools from the ones that responded to our surveys. So I think this really needs to be education, really around the nuts and bolts of what is a miscarriage, what is IVF, what happens, how can it affect people, and what can we do to help? So even if that's just teaching people some stock phrases to avoid and some stock phrases to use. In terms of limitations, we can't determine prevalence from this study design. We may have potentially selected for people with stronger feelings, but that's always the way with these studies. As I've said, some of these experiences were recalled from many years ago, so there's a risk of recall bias there, that people might not be accurately reflecting what they heard and felt, but I think the fact that those people from 20 years ago took part really shows how important this is, and also important to say that those experiences were typically indistinguishable from people who amazingly were filling in the survey literally as this was happening to them. It's incredible that some people were doing that. Not many men took part, only 20. It could be because we were an only female research team. It could be because we were advertising in spaces that were mainly more female inhabited, but potentially it could also be because men really feel that this shouldn't be something that they should be bothered about, or there is some data that suggests that men actually genuinely don't feel quite so bonded to babies when they can't see a bump. So it's likely to be heterogeneous, but those men's experiences suggest that there's a really big piece of work to do in this space. So in terms of conclusions, individuals affected by this describe variable workplace experiences. Bad experiences negatively affect people, career, and workplaces. This is leading to loss of retention in job spaces, but it's also really negatively affecting people's mental health, sometimes for more than 20 years. There are likely many underlying causes, but lack of education, lack of understanding may well be a big contributor in terms of how people are handling disclosure of these experiences. And as we can see, little changes can make a really big difference. So we submitted this yesterday to the Vet Record. If anybody sent it to review, please say yes. And then hopefully we'll be able to start a wider discussion. I think this needs to be integrated into all of the RCVS resources. I think it needs to be in vet schools. I think there needs to be really specific resource and education packages developed around this. I'd be really happy to answer any questions. And there's some support networks that are all fantastic, actually, for anybody that's affected by this. Thanks very much.
You've partly answered this, but what really specifically do you think would be beneficial for vet students to know about this?
What would be essential?
What would be most beneficial? Like, given it's always a packed curriculum, there's always stuff to. What would be the key things you think that vet students should learn, or vet nursing students? That's
a tricky. I mean, I guess that it happens, that this is a thing is number one, that the statistics around baby loss, the fact that they're likely to encounter people when they're on EMS who are having these experiences, that they may be spoken or unspoken, that it's really easy to trip into these things without necessarily knowing about it. I think probably some sensitive communication strategies, literally almost teaching them some of the things that they could say, like stock phrases, so that they're not potentially getting themselves into trouble. I think as students then potentially knowing maybe even when to leave a room if a discussion's happening that they feel that they maybe are uncomfortable around. You know, if there's a discussion about this between two people, maybe stop cleaning that candle and just go and find something else for you to do rather than lurking in there if that's what they need. But also then how to look after themselves. And I think really just education on literally the nuts and bolts of, you know, what happens in IVF, almost what happens, how people might feel after a miscarriage, and how to support people around that. So, a lot.
Awesome. Thank you so much.
Can't hear it. Will it come on?
No.
Doesn't come on? Is it on now?
Yeah.
Ah,
Thanks, Petra. Yeah.
Need to yell. Right. Thank you, Zoe. Really, really interesting. One question I have is you said that there were some people who were very comfortable to talk about it or relatively comfortable, and some who preferred a clean separation between private and work. And yet, if I remember correctly, the people who expressed a positive experience that spoke of a workplace where private is not separate to work. And so my question is, was there it probably wasn't because of the way the data was collected, was there any way to match which respondents felt that they had a personal connection to work versus independent from their pregnancy experience to those which didn't?
No, I think feeding more into Naomi's kind of identity type talk, do you mean, Petra?
Yes.
Yeah. No, we didn't explore that, and it would be really, really fascinating to do that. Some of the people who didn't disclose, absolutely, they wanted to maintain their privacy, and they felt that work was their coping place, and they didn't want to almost contaminate that safe space with their own personal identity. Whereas other people were telling us, you know, I went back to work, and after a week of quite a lot of support, they felt very frustrated that their managers almost wanted them to turn it off and just get back to work as normal. So there's a huge heterogeneity in how people wanted workplaces to have a role in this or not have a role in it. And I think that's a really key part of any discussion or any policy needs to be that individualisation. But no, we didn't specifically look into that, but it would be really, really fascinating too. And there was a hint probably from those data that that is a messy interface.
It will, yes, I can imagine. It will always be very messy. I just guess also that if, and it's a bit of a, well, it's this interaction between the system and the individual, isn't it? And then if you have got a supportive system, then also perhaps individuals will be happier to share and disclose certain things if that then is received in a supportive way.
Absolutely, and some of those that weren't disclosing were specifically doing it because they'd seen other people having pregnancy discrimination or they'd had a negative experience themselves. So that was very much, it was very much that they felt it was not a safe, psychologically safe space in which to share. So there's certainly I would say quite a majority of people that would like to have been able to talk about it, but just didn't feel that they could because it wasn't safe to do so.
Thank you.
I'm happy to take any more questions in the lunch break if that's okay.